New at 10 tonight, University of Montana is quietly hitting a very high mark in the ongoing effort to retain newly trained physicians to work in Montana, with a strong majority of UM graduates deciding to stay and serve patients across the state. 5 years ago, there was a growing concern of finding enough physicians to meet the demand not only in Montana's urban centers, but also at its far-flung rural hospitals. That's when University of Montana decided to tackle the problem with a new physician retention program. And the success is proving to be remarkable, even in a relatively short period of time.
We graduate 10 residents per year, and over 70% of them are staying in Montana as primary care or rural physicians. So that was a singularly good addition to Western Montana, and a real benefit because we're really sort of helping incrementally solve rural healthcare issues.
Appearing on our most recent Face the State program, Dr. Humphrey said the success is part of an overall change in healthcare and education at UM, where the approach is now interdisciplinary, involving different forms of care in a single unified approach to improve patient outcomes or preferred results to help individuals.
The opportunity to do rural care and do underserved care has allowed us to really be more impactful in that regard. So we're up in the Flathead, and we're down the Bitterroot with our iFarm programs, doing screenings and so forth. But to be able to get practitioners into rural areas has always been a challenge.
Humphrey says part of that challenge has always been the lonely nature of rural health care, and that's where a feeling of teamwork with other health professionals can help.
Part of it is, when you're a solo practitioner, whether you're a physician or a physical therapist or a social worker, it's tough to be a solo practitioner.
Humphrey says the trend continues to show a growing demand for health care for aging Montanans in the coming years, and while hospitals are upgrading their equipment, they still need people. And he says the physician retention effort is helping build a pipeline that's also convincing more students to seek the profession, especially when coupled with a Montana lifestyle.
We're also able to recruit residents who have a commitment to rural care. So they're not going to be trained here and then just run off to a specialty somewhere in an urban center. So we're pretty selective.
If you'd like to find out more about UM and its health programs, you can watch the full Face the State program on our YouTube channel.